Well, it looks like we're now broadcasting. Good morning, and thank you all for attending City and State's 2020 Suffolk County Virtual State Legislative Forum. I'm Zach Williams, State Government Reporter for City and State. We got a great group of state lawmakers here. Fortunately, we're one lawmaker short with Assemblyman Doug Smith had to duck out because of an emergency early on, but we still got a great conversation going. We're going to be talking about all sorts of important topics important to seniors, including nursing homes, long-term care, family caregiving, prescription drugs, affordability, financial security, so many important things, especially in these times. But first, I want to thank our great sponsor, AARP, for helping us put on this great event. And we're going to hear from Bernard Macias, who serves as the Associate State Director for Long Island, who's going to offer some opening remarks. He oversees community outreach and engagement, local member experiences, federal, state, and local advocacy organizations, and also directs the island's organizing for 400 very active AARP volunteers. So without further ado, let's turn it over to Bernard and see what he's got to say to kick things off.
Thank you, Zach. Good morning. And again, welcome to City and State, Suffolk County State Legislative Forum, sponsored by AARP New York. Again, my name is Bernard Macias. I am the Associate State Director for AARP right here on Long Island. And I want to thank all of you for joining us today virtually. In a few moments, Zach Williams of City and State will introduce our special guests. And these are your state legislators who represent you and your neighbors from Suffolk County in Albany. Zach will introduce each legislator, then launch right into questions so we can carve out as much time as possible to hear their positions, plans, and priorities on issues very important to the 50 plus. And I want to emphasize that AARP is a nonpartisan organization. We do not contribute to political campaigns. We do not endorse political candidates. So the purpose of today's forum is solely to educate our members and our participants on issues of importance so that they are better informed citizens. So picture this, if we were all gathered together in a big room, like we used to do, I would ask for a show of hands of how many of you have a loved one in a nursing home, or how many of you care for an older family member or loved one at home, or take one or more prescription drugs regularly. I would imagine that a lot of hands would be up. Nursing home conditions, family caregiving, and prescription drug costs are all leading issues for AARP today. And we'll be asking our state legislators what they're doing or plan to do about those issues. I want to thank our volunteers and members from Suffolk County who are here with us today virtually. I want to note that they are also very key to the work that we do here on Long Island. That includes, as I know many of our state legislators can attest, volunteers showing up with those red AARP shirts and making sure that our state legislators are aware of and responsive to the needs of 50 plus. I'm sure they and all our members will be listening carefully and are anxious as we hear from our lawmakers. So with that, I want to thank City and State again for hosting this forum and turn things over to Zach Williams.
Thanks so much. So Suffolk County is a pretty special place. You guys got a pretty diverse set of lawmakers, Republicans, Democrats, and of course, the Assembly's only independent member. Let me introduce them, and please, once I say your name, just give a little wave so we can all put a face to the name. We got Phil Boyle, New York State Senator for the 4th District. Fred Thiele, Jr., New York State Assembly Member of the 1st District. Steve Englebright, he'll be stepping in a minute, but he represents the 4th District out there, and I believe is the only geologist in the New York State Assembly. And we got Joe DeStefano, New York State Assembly Member for the 3rd District. Michael Fitzpatrick, Assembly Member for the 8th District. And also joining in on the discussion is Bill Ferris, New York State Legislative Representative for the AARP. So hopefully we'll get Assemblymember Englebright in on the discussion a little bit, but there's no shortage of lawmakers right now. We got a couple questions that I've come up with beforehand, and we're gonna try to get them all posed to the lawmakers, in turn have as good of a conversation as we can have in the new normal via Zoom. Again, feel free to drop questions into the chat channel, and we'll see if we can get them in towards the end. So I just want to refocus again. We're talking about some really important issues. COVID-19, the state budget process has been upended by the pandemic, and state lawmakers getting ready to head back to Albany now that the elections are over. We'll make some really important decisions on how to keep important programs for seniors going forward. And of course, state budget, all of which impacts seniors all over Long Island and across the state. Some of the topics we're going to try to get to include nursing homes, long-term care, family caregiving, prescription drugs, food access, financial security, and social isolation. Some of these problems are more obvious than others. So let's jump right into it with the first question. And this involves, many older New Yorkers are homebound due to the coronavirus, and their family members are working harder than ever to keep them at home and healthy. But many of them rely on home and community-based programs funded through the State Office for the Aging, including home delivered meals, transportation services, which help these people remain in their homes and communities as they age, rather than having to, have to go live in some sort of institutional care setting. So, I'd really like to, we'll start off with the guy representing the 1st District. He's got the lowest number. Assemblyman Thiele, with so much challenging state finances, how can lawmakers protect programs like home delivered meals, transportation settings, and other programs that help people stay in their home from getting cut?
Well, I think that regardless of the question that we talk about today, or regardless the service or program we talk about, there's going to be a recurring theme that's going to come up again and again. And that is that, most, if not all of the decisions of government are decisions of money. And, COVID-19 certainly has had its impacts on New York State with regard to our health and our safety. But, the impacts on the New York State budget and our ability to provide services, cannot be underestimated. As we sit here today, we are facing a enormous budget deficit that we are still going to need to deal with. We are facing another surge in cases, which may have an additional economic impact and an impact on state revenues. There has not been any action yet from the federal government with regard to a stimulus bill. Whether or not such a bill gets passed by the lame duck Congress between now and the end of the year, or becomes an issue for the next administration and the next Congress, remains to be seen. So we're in a position of great uncertainty. But what we do know is that we will be returning to Albany, and we're going to have to deal with this. And I think, given the election result, I don't know what a federal stimulus bill is going to look like. I have the feeling that there will be one, but I think at the end of the day, it would be over optimistic to believe that suddenly there's going to be a bill from Washington. New York State's going to get a check, and all of our problems are going to get resolved. So, whether it's long-term care or nursing homes or education, we're going to be dealing with some substantial issues with regard to funding. And, the question that we're going to have to deal with is whether or not, are we going to reduce services? Or are we going to find other options to raise revenues to supplement whatever help we get from the federal government? So, you mentioned, long-term care to begin with, and, state funding for that. I mean, right now, the governor is withholding funding for many, many programs. And the issue will be, when does that withholding of funds become a cut? When does it become permanent? So, I don't know the answer to all the questions that you're going to ask with regard to these programs, but I can identify the issue. And from my perspective, number one is to get as much money from the federal government as we possibly can to help us address what is a continuing crisis. And then secondly, I think we're going to have to, as painful as it may be, look at revenue increases. And, I think the focus on that in Albany will be on raising revenue from the wealthiest of New Yorkers. And of course, that has economic impacts also. And then the issue will be, after the end of all of that, is that what programs can we save, and what might be enduring cuts? What will our priorities be? So I think we can outline, what we're facing and what, decisions we'll have to look at. But it's literally until we know what the federal government is going to do, that still colors what might happen or what we might do on the state level.
I hear you there. These are a lot of issues that are not typically, where there's a lot more unity between Republicans and Democrats compared to, some of the other more controversial topics in state politics. I'd love to throw it over maybe to Assemblymember Fitzgerald. What are your thoughts on how to protect programs like these that benefit seniors and help them stay in their homes? It sounds like you're muted, Assemblyman.
I said, where's Assemblyman Fitzgerald? I don't know him.
I beg your pardon, Fitzpatrick. So sorry.
Well, I don't disagree with Fred that we are in unprecedented times. I think we'll get some kind of a bailout from Washington, but I don't believe it should be as much as the governor wants. I think the governor, we should get what we're entitled to meet our COVID expenses, but frankly, no more. Because when I hear the governor talk about reimagining things, the one thing I'm not hearing is, how about reimagining state government and start looking at reform? Everybody wants more revenue. We have a problem with taxing the wealthy because they're mobile and they're going to move. I remember the governor making a big deal about recruiting Eric Schmidt of Google to be part of his reimagining task force. Well, Eric Schmidt is now in the process of becoming a citizen of Cyprus to escape the coming Biden tax increases. We better be very careful about just continuing to raise taxes because, in my opinion, that is not the answer. We are seeing, whether it's red light cameras, casinos, we have progressive members that want to legalize sex work. We are, sports betting. None of these solutions, quote unquote, make your community a safer or better place to live in my opinion. So I think there's an opportunity here to look at reforms so that we can bring down these structural costs more in line with what is going to be a smaller economy. During the interviews that we all had with our friends in the unions, I would say to them half in jest, but full in earnest, I said, you gave me your pre-COVID questionnaire. Where's the post-COVID questionnaire? Because they're asking for things that, they have not. I said, if you think you're going to come through this pandemic on the other side the same way you went in, I think you're kidding yourselves. I happen to believe that this situation is more serious than people realize. We've lost a lot of jobs, many of them permanently. We've lost businesses, many of them permanently. The real estate markets, especially in New York City, have changed dramatically, which is going to lead to certiorari claims, a reduction in assessed value of these properties. The criminal justice reforms have made the cities less safe. And I think that has more of an impact, quite frankly, on the city coming back than COVID does, frankly. So I'm concerned, and the reaction of government is always look for more revenue, look for more revenue. I don't think there are any more revenue opportunities out there that I would be favorable toward. And I think we need to get serious about reform, and nobody wants to deal with that because it requires a very rough conversation with some interest groups that think nothing should change.
Senator Boyle, maybe you could jump in at this point, kind of lend us the Senate's perspective. How do you see these issues playing out in your chamber?
Yeah, thank you, Zach. And I'd like to thank City and State and AARP for this forum. I think it's a great thing to do. And my wife and I are probably the newest AARP members in Suffolk County. So we just got our card the other day. Very excited. And the theaters are closed, so we can't get a discount. That's the bad part. But seriously, I want to agree with both my colleagues. And one of the things that they haven't touched on, though, and remember that when this COVID pandemic started in March, early March, the legislature gave the governor emergency powers. I think it was March 2nd, right? And he was saying in his daily briefings, we're going up a mountain. We gave them the emergency powers rightfully at the beginning. We went up the mountain, we plateaued, and now we're back down. About a little bit of a bump, but we are very low in our numbers, and yet he still has the emergency powers. So all these budgetary issues we're talking about, the programs that need to be funded, we as a legislature, as a co-equal branch of government, we should be playing a role in it. But the governor is unilaterally making all these decisions, and that needs to change. We've made a few attempts to take the powers back from the governor, and when we have our legislative sessions, we do it on Zoom now. We don't even go to Albany. If God forbid the numbers start going up dramatically, we could give them the emergency powers back again. But we need to, as a legislature, take the powers back from the governor and make decisions with him on the budgetary issues like the programs we're talking about. That's vitally important.
And I'd like to invite Assemblyman Englebright to join in now. Maybe you can give us a wave. It's glad that we got you now. We've just been talking about how, so many programs are important to keep seniors in their homes, from, emergency food programs to long-term care. Obviously, the budget has been completely upended by the pandemic. What are your thoughts on protecting programs from upcoming budget cuts? Oh, I think you're muted.
There we are. Okay. I think it's vitally important to find a way to keep as many of these programs as possible. I chaired the Committee on Aging for 5 years, and it was a time when we were putting many of these programs into position because they save money, basically, or they have a preventive impact in terms of preventing additional costs. But that hasn't changed. The programs that help seniors stay in their homes, that are programs that are carried out through the county offices for aging, give us a tremendous amount of economy relative to the alternatives of trying to care for seniors, especially during a pandemic, when any alternate bed space is being very, very competitive for people who are sick. Keeping people in their homes at a time when we have a pandemic raging. In Minnesota this morning, 135% increase in the last 2 weeks. That's coming our way again. The third wave that is ravaging middle America is going to come back to New York. We are better prepared for it, having been the population that suffered from this first in this part of the continent. But I don't think we're immune from repeat, and bringing seniors out of their homes in any way is only going to accelerate the pain, the suffering, and the death. So I don't have, a specific answer. I'm listening to what Assemblymember Thiele said a moment ago about we're kind of waiting to see what the federal government is going to do in terms of providing us with some resources. I don't disagree with any of my colleagues in terms of the perspectives taken. My conservative friend from Smithtown is correct. This is also an opportunity for us to seek efficiencies beyond what we had imagined before. And that there are limits to what we can do without undercutting the long-term fiscal stability of the state by driving too many people away because we overtax them. We have to find a balance. the first thing we have to do is find out what we're dealing with in terms of resources from the federal government. I don't think there's any doubt that we're going to be facing some very difficult choices, though. But our elders, they're the ones that brought us to the dance. We wouldn't be looking at such a prosperous New York pre-pandemic and presently if it wasn't for the work and sacrifice made by people of our parents' generation. And I think it's important to find ways to keep the programs, especially the programs that keep those loved ones and neighbors of the same age safe from this pandemic and keep them in their homes.
Assemblyman DeStefano, what are your thoughts? What sort of programs are you keeping an eye on?
Well, thanks for letting me go last, because everybody in front of me kind of took a lot of the things I wanted to say, but that's okay. I think Senator Boyle pretty much started where I wanted to lead into with, is that we are equal branches of government, and to have one person make those decisions for all of us, this is to me, aging is and the AARP system and everybody that falls into this category, they're one of the most vulnerable in our society. We should be protecting them as best we can. And to have one person have control over all of that is not making a lot of sense to me. I mean, yesterday we heard another executive order saying that, we're going to shut down restaurants and bars at 10 o'clock and things like that. I guess COVID doesn't happen after 10 o'clock at night. I don't know. But the bottom line is that when you start taking more tax revenue away from us, it's going to make that even more challenging to try and fix it. Because, we all live on taxes, especially out on Long Island. We're one of the highest tax places in the state. And now we're going to close down businesses who are already struggling, putting more stress on the economy and things like that. So now how do you make up for that? I understand there's a problem out there, and, we need to deal with it on a bipartisan fashion. That's the way I govern. I want to make sure that both sides get to the dance. And I want to make sure that we all have an input into what it is that's what the outcome is going to be. And just having one person make that decision for all of us is just not the right way. We weren't elected to watch the governor make all these decisions. We were elected to represent our constituents, and we have a very serious problem with all of the good programs. I mean, we do partner with the town and the county on certain things that help Meals on Wheels and stuff like that, but that's all funded from the state. So, we got to make sure that those programs exist, especially for those who can't get out and don't want to get out, frankly, because they are afraid of, being in the middle of this and going to stores and things like that. But again, Senator Boyle took the thunder right out of me, because that's exactly what I was going to say, is that we need to get back to Albany. We all need to work together in a bipartisan fashion to get to some resolutions that are going to help us in the future.
So I think it's a good point. And then your discussion of bipartisan cooperation is a good time to kick it to Bill. Maybe you can offer us the advocacy perspective. Seniors are a very vocal political constituency, so many things up in the air for them. How do you see the political landscape in the upcoming weeks and months at the state level affecting these very important issues?
Well, I think from a state perspective of a state office for aging budget, and Assemblyman Englebright knows this very well as a former aging chair in the Assembly. There's a lot of great programs in that agency that help people stay at home. And when you help an older person stay at home, you're slowing the growth of the Medicaid program. And we all know, and all the legislators know, the Medicaid program is a tax, it's revenue, tax-based revenue, general revenue, and the state budget that pays for that. So we've always thought, and many people have thought in the state, the more you invest in non-Medicaid home and community-based care, you're going to save money on the Medicaid program and save money on the need to raise taxes in other areas of the budget. With that said, with the budget deficits that have been reported in the media, to be quite honest, AARP is getting a little nervous coming into next session. We don't know, as the Assemblyman said, and the Senator, no one really knows what will come from Washington, how much it should be, how much we'll get. And, we'll have to see what that number is. But if you have billions and billions of dollars of deficits in general revenue in the state of New York, you have to look at the agencies, and the State Office for Aging is an agency and they have a budget, and we're nervous that budget may be cut. We think it would be a mistake to cut that budget, but to be quite frank, Zach, we're a little nervous on that front.
You know, so many of these issues were issues even before the pandemic began. Prescription drugs is something that really comes to mind, you know, something that disproportionately affects seniors. Who would like to jump in here and really say what can be done, especially outside of issues of necessarily funding in the budget? How can we help decrease prescription drug costs for seniors?
I guess I'll go first, since it's
maybe we can throw it straight to Assemblyman DeStefano since he went last time.
Well, one of the things that I've always in my real life before I became an assembly member is I think competition really is a key to trying to reduce costs, RFPing certain things that would be able to be competitive when it comes to, I mean, we have Moderna and Pfizer trying to see who's going to be the first one out with the vaccine. So they're going to be competing. Competition is really a good thing. And I think that when you put people butting each other head to head about trying to be the first ones to do that, I think by putting more of it out there for them to bid on or things like that, I think that creates a positive trickle down effect where it now becomes more efficient and it becomes less costly when there's more competition. I mean, that's true in anything, but I certainly believe that in prescription drugs, it hasn't been tested as far as I can tell. So maybe that's a good way to start. That's just my opinion.
Senator Boyle, as a newest member of the AARP on the island, what are your thoughts?
Well, I think to get to the Assembly members' perspective of competition, one of the things that we should do and we have not done to the extent we can, and it should be on a national level, is importation. You know, as New York State, we are right on the border with Canada. You go a couple miles up north and you're paying a lot less for the same drugs that we're paying as New Yorkers. And that can be done, obviously, on the federal level, it should be done. But competition both in importing prescription drugs made in other countries that pass our safety standards, but also even with insurance coverage, allowing people to get insurance policies and pay premiums, perhaps with an insurance company that's based in another state, creating a national competition to lower the cost. I would say parenthetically that the AARP, the red shirts coming up to Albany is a tradition, and it's very important for educating our members. Well, you got a big job in front of you because it looks like we're going to have 3-4 new members in the state Senate from Suffolk County. And so I'm the only, it's amazing to think about it. I've been in the Senate 8 years now, and I'm going to be the dean of the Long Island delegation, the most senior member after only 8 years. It used to be like 40 years and you were the dean of the Long Island delegation in the Senate. But so a lot of new members, a lot of issues. I can help them out a little bit, but I need the support and help of AARP to educate the members on issues just like prescription drugs.
Now, Assemblyman Fitzpatrick,
Yep.
You've been in the Assembly now a few years. You know, this issue came up last year. The governor said, "Oh, we're going to, you know, import drugs, figure it out how to get them from abroad or decrease." Excuse me. You know, why hasn't this happened? You know, we've heard these ideas of importation for so many years already.
You know, Zach, I'm not going to pretend to be an expert on the economics of the pharmaceutical industry, but you know, the cost of development of these drugs has to be absorbed by somebody. And I think for most drugs, the US consumer absorbs most of those costs because these governments, whether they, you know, the government of Canada, Britain, elsewhere, they can regulate these prices, which only pushes those costs higher and higher onto the back of the American consumer. What I'm most concerned about is we don't want to do something that will inhibit the innovation or the incentive to innovate. You know, this vaccine produced by Pfizer, they were not part of Operation Warp Speed. They did this entirely on their own. And I think that's laudable, that's good. They're following all the proper protocols. And one thing that really bothers me is when I hear Ezekiel Emanuel say, well, Americans shouldn't be first in line to get this vaccine. We should distribute it globally when Pfizer paid for it out of its own pocket here. American consumers should be first in line. So importation, if it works, I think it's probably a short-term response. It's not a long-term solution. I think competition is helpful, but I would consult people far more wise than I in the pharmaceutical industry. But you don't want to hurt innovation, because the pharmaceutical industry, it's easy to criticize big pharma, and they deserve some criticism. However, it's the pharmaceutical industry that created this vaccine that will be, I'm sure some, if not most of us, will be taking shortly. But they've also produced a number of wonderful solutions to what ails all of us over the age of 50.
Let's get a scientist in here who's also an elected official. Assemblyman Englebright, what do you think about how these issues of innovation play into prescription drugs?
Well, obviously, the research, the incentive for research and development is important. So the profit motive is basically driven economically. When you're dealing with a for-profit company like Pfizer, there have to be some limits. That's where we come in. And what we need to do is find a way to make access to the miracles of pharmaceutical research available. And there are several different tools. Some of my colleagues have mentioned those. Importation certainly is one. I don't think anybody has yet mentioned accelerating legislatively the access to generics and bulk buying. Certainly is something through institutions that can then distribute to, if it's hospitals, to their patients, or if it's offices for aging or health departments. The distribution puzzle is something that needs to be addressed, but certainly the possibility of buying in bulk is something that should be considered as well. But I agree, we don't want to get so carried away using our legislative discretion that we take away the incentive for innovation.
Assemblyman Thiele,
we seek balance in almost everything we do, and we'll have to do that again, I think.
how do you think we can maintain that balance, Assemblyman Thiele?
Well, that's the question, right? I mean, the issue, certainly we want innovation. Our lives currently depend on innovation. I mean, it was innovation and, the various companies and, the federal government has provided some assistance, but as was said, there's been competition. So we certainly don't want to thwart that. We're one state out of 50. So I think to some degree, there's some limitations as to what we can do, but there are some things that we can do along the edges. I mean, there was legislation, a year or so ago with regard to pharmacy benefit managers and greater regulation of them. And all our local pharmacists were ringing our phones. They wanted that legislation to happen, but it got vetoed. And so, you can't underestimate the political power of the industry either, because that bill got vetoed. So listen, from my perspective, some of the issues that were raised here today, and that is, enhancing competition, utilizing, New York's a big state, utilizing our buying power as ways to reduce prescription drugs. I think they're all good ideas and things that we have. I think we had a great awareness of them in the wake of the pandemic and its continuation. I think we realize more than ever, that these are issues that really need to be right at the top of the priority list. So, I would hope that in the context of as we continue to respond to the pandemic, that this would be a priority in Albany for 2021.
I think it's great we've brought in innovation into the discussion, because I'm sitting here so afraid that my internet connection is going to cut out and that I'm not going to know what's happening in this event I'm moderating. And luckily I just hold still and apparently people can still hear me. You know, broadband, we hear so much of it discussed as an upstate issue. You know, should there be more access in Adirondacks or in rural areas? But, you know, in Long Island here in New York City, where I'm at, broadband can still be a very big problem. And that has a lot of implications for people's health. You know, whether it's getting good information, accessing telehealth, et cetera. You know, let's hope the internet doesn't freeze for me, but who wants to jump in and say what we can do about that to help vulnerable seniors on Long Island?
I'll jump in. You know, broadband isn't just an issue in the Adirondacks, you know, and the access to Wi-Fi. You know, I'm out here on the east end of Long Island, and, you know, people think it's the Hamptons, the lifestyle of the rich and famous and all of that. But it's really a very, very diverse community. And, you know, we had a situation for years where, you know, in the summertime, you know, Wi-Fi access would become very difficult as the population doubled and tripled because of the deregulation of the communications industry. It's really market driven, and to a large, you know, companies like Verizon or Optimum, they didn't want to spend money on the East End on fiber optics and things of that nature and updated technologies, because they said you don't have the population out there for that. So, you know, we got used to in July and August weekends of really having difficulty accessing Wi-Fi. But now, in the face of the pandemic, it's a year-round event. People came out to the east end of Long Island to escape the city and to you know, to feel safe during the pandemic. And they came in March and they have never left. And so we are seeing issues with regard to cell phone service, with regard to Wi-Fi, and you know, slowly but surely, we're getting our communications companies are addressing that. So listen, it's a free market. You know, we talked about the pharmaceutical industry. It's certainly a free market with regard to communications, but we need to, as elected officials, put as much of our influence and advocacy on these companies to really expand and invest in broadband. You know, it's not just that you can't, you know, you can't access the internet on, you know, on the weekend, you know, to get the ball scores or something. It is basically, you know, especially as we're going into the winter and as we're seeing the COVID numbers going up, a lot of our schools are, you know, perhaps are going to have to rely more on virtual learning. And it's a very uneven playing field out there when it comes to access to the internet and ability to access Wi-Fi. So, you know, from our perspective, you know, certainly there's been more and more meetings with these giant communication companies. We really need to be putting the pressure on them, and through the Public Service Commission, with the authority that they do have, to get investments made and to incentivize investments in that form of infrastructure, because it affects so many aspects of our lives now.
And, you know, a lot of seniors live on fixed income, you know, prescriptions, broadband, so many different things. Before we throw it to some more of our elected officials here, I was hoping, Bill, you could tell me a little bit about, you know, some of the issues that seniors are facing when it comes to prescriptions and broadband, and really making, finding some solutions.
I'll just start with the RX prescriptions. There's a stat that AARP had pre-COVID research that we did in New York, and we found that 20% of New Yorkers delayed taking a prescription drug because of cost. And that number has stuck with AARP for a while. And, you know, we will continue to do research because, as we all know, the research we did pre-COVID really isn't relevant to the discussions now because we're in a COVID period. So if the number was 20% in 2017, I think unemployment and, you know, people had some kind of, you know, money in their pockets. Now the world has changed. We have high unemployment. We have a lot of people spending money. The economy isn't that great. You know, that number could go up. So one of the issues that AARP is looking at in next session is the cost of prescription drugs. And one thing, I think Senator Boyle mentioned it, importation. Couldn't agree with you more, Senator. And I think someone else mentioned competition. Couldn't agree with you more on competition. But with importation, the governor actually in his policy book last year is going to establish a importation commission to put together a plan and hopefully send it to the federal government to get approval to import drugs from Canada. So that's something that we're really going to hold the governor to hold his feet to the fire on that. There are other issues. Everybody on this panel, I believe, has in their career weighed in, supported, spoke up in conference about the EPIC program. It's probably one of the most popular senior programs in the state of New York for prescription drug coverage. Maybe it should be thrown back on the table in next year's budget. Should it be expanded? Should the benefit be increased? Do we increase the eligibility levels because of what's going on with the economy and COVID? Certainly should be a discussion. Another big issue for AARP is, I think someone mentioned generic drugs. There's bills in the legislature right now that want to bring generic drugs to the marketplace quicker and kind of do away with or expose the agreements that manufacturers, brand manufacturers have with generic companies to keep their drug off the marketplace for a while. We should expose that. Maybe we should eliminate those side deals. The state of California did it. If California did it, why wouldn't New York do it and bring those cheaper drugs into the marketplace and increase competition and the price of drugs? So, there's in bulk buying, I believe the governor during some of his COVID press conferences said that they're going to look at working with other states to bulk purchase PPE. If we can bulk purchase PPE, why wouldn't we bulk purchase prescription drugs with our neighbors? I mean, all these should be on the table and be discussed in Albany in 2021. But as far as broadband, and I want to thank all the legislators here today because I think you all voted on the bill. There was a bill in the Senate that passed. It passed in the Assembly, has not been sent to the governor to have the PSC. I think Assemblymember Thiele, you mentioned the PSC, and to empower the PSC to study and to map the whole state of New York of where high internet access exists, where it doesn't exist, what are the upload speeds, what are the download speeds, and we think the governor should sign that bill. And because in the pandemic, we've seen that telehealth is becoming more front and center in our healthcare system. If we're going to have a robust telehealth system in New York, it is AARP's belief, and I think over 20 organizations signed a letter to the governor, that we need to look at high-speed internet access across the state to advance telehealth and other issues, because the internet certainly is part of our daily life right now. And we should really see where it exists, where it doesn't exist, where it's slow, where it's fast, where it's affordable, and where it's not affordable. So not to throw all these issues on the table to our elected officials this morning, but all this stuff is very, very important to AARP.
There is also this issue of 5G, the fifth generation. There was a pull-out section of the Wall Street Journal yesterday that I haven't read yet, but we'll be reading it thoroughly. But this transition of 5G is very important as well. China is way ahead of us in that area, but that is the wave of the future also.
But if I could, one of the issues that I've spent many, many hours on in the Senate, I represent half of Fire Island and the barrier beaches of the town of Babylon, and we have broadband issues there forever. And obviously add that on to seniors, AARP members from other parts of the district I represent and other parts of Suffolk County. We had a program a few years ago, you may remember, we put $500 million into a broadband system to try and get broadband to different parts of the state. We were able to get some down here on Long Island, but we really need to redouble our efforts and put more money into it on a statewide basis. One reason is because of telehealth. Obviously, we see now the vital importance of telehealth, but also what are people doing now? They're working from home. And I think a lot of companies are figuring we don't have to have our people go into an office and pay rent. They can do just a job at home. But of course, that means high-speed internet access for everyone at a lower rate, which is going to create more competition for those people who are trying to get it who may be retired. So I think the government does need to be involved to make sure, whether it's 5G or whatever the next best thing is, to make sure everyone has access to it for their healthcare, but also for their jobs.
Did Assemblyman DeStefano, did you want to jump in? Did I see your hand up?
Yeah, well, one of the things that, and it was mentioned again by the previous three One of the things I find really ironic is that there's such a monopoly, especially here in Brookhaven town, where it's optimum or nothing. And to me, that's unacceptable. I mean, we need competition for these types of things, and it's not cheap. I got to be honest with you. My internet bill is probably like $140 a month just to have internet access, and that's crazy. That and we need to bring those costs down, especially for those that are on fixed incomes and are vulnerable to now the society of where a lot of these things are being done from home now. And while we're sitting here, my internet connection is starting to get a little bleaky from time to time. But that's the only game in town for me. It's optimum or nothing. And so they got you. Where they got you, and you just got to pay it just to have access to get internet and Wi-Fi. So I think that the competition needs to be brought up, and I know Mr. Englebright knows this. The bottom line is we've been asking forever the town to give us more resources. Optimum is the only game in town, but Verizon doesn't want to do any the underground stuff. It's just too costly for them to come into Brookhaven and put those connections together. But now with the 5G, maybe it'll be a better access. I know every firehouse from here to Kingdom Come has these towers on top of their firehouses now, collecting rent from these providers like Verizon and some of the other ones out there. But we need to do better. We're in the 21st century. We should be able to do better when it comes to getting this stuff out there to people and having communications. Like everybody before me said, this is the wave of the future, and we need to be ahead of it, not like behind, like we are with China. And they're way ahead of us on this, and we need to do better. My opinion.
And of course, it wouldn't be Suffolk County or Long Island if we didn't talk about utilities. Not just the storms, but throughout the pandemic, the moratorium the governor imposed months ago provided some relief. But what can we do on that front to help seniors?
I'll go first, Zach. I think the first thing, and I believe it was in Newsday, is to really get Suffolk and Nassau County to get the low-income people on the island into a program that the PSC created 4 or 5 years ago, saying that someone who at a certain income level should not spend more than 6% of their income on the utility bill. It was a program done by the PSC. All the utility companies all across the state of New York supported it. It's been becoming part of the cases that the PSC does. But when you look at Long Island, there's a very, very low rate of people participating in that program. I know it's not really a legislative issue right now, but if it's not done correctly, as the legislators know, the ball goes into their court and they can try to do something. But for now, we're really encouraging people to sign up, have the counties promote this program, and get people on this low income utility rate, which is already, it's been around for 5 years. The other thing about utilities, and I know the legislators will talk about the storms and what the governor has proposed, but one issue for utilities for AARP is the terminations. I mean, the legislature did a great job of allowing people not to be terminated during the state of emergency. The legislature did a great job by saying that if you, once the emergency's up, you get 180 days, and thank you for that. But what happens after that? What happens when all the state of emergency is up, the 180 days, if someone signs up for that? What happens after that? I mean, it all could come to a head in March of next year. And you could see significant terminations, not only on Long Island, but all across the state. And I think it's, utilities need to be paid, but we also need to have people have their lights on. So I think some of the assemblymen, and I think the senator said a lot of the policy is a balance. And that balance of keeping the lights on and having the utilities get paid, that's one heck of a balance to try to figure out in Albany in the next 6 months. And it's another issue that's very troubling to AARP, is that termination storm that could occur in March.
Assemblymember Thiele?
Yeah, LIPA, PSE&G, Long Island, we had a very unacceptable experience during the tropical storm this last summer that I think highlights, the problems that we have. And yes, the cost of utilities certainly remains and continues to be an issue. And, that is very, very important. And, programs such as CCA consumer choice aggregation is certainly being looked at, by, the towns on Suffolk County. And, one of the things that was mentioned, the PSC, LIPA is not subject to the jurisdiction of the PSC, and LIPA has not been forthcoming in encouraging programs like CCA. So, that's one example. But also is reliability in communication. We had senior citizens certainly that were out of power and couldn't get a hold of their utility company. All communications broke down. And we had others who were supposed to be on a list, because they have serious health needs and were supposed to get priority attention as far as having their power restored or making alternatives. All of this failed. It was a complete and total failure. So, it's not just looking at rates, it's not just looking at communications, but, overall, with regard to LIPA and the Public Service Commission, we need to look at a whole new everything. We've got this Rube Goldberg system of between, the Public Service Commission. There's a separate Long Island office, but they don't really have any authority. They can just make recommendations. We've got LIPA, which isn't really responsible for anything anymore, except overseeing the PSCG, but they've only got 50 employees, and they're supposed to oversee PSCG. And then you've got PSCG, which for which there's really no oversight at all. So, it was a total failure this summer. And I think, to make sure that people get what they're paying for and get proper service, and avoid the kinds of problems that have recurred on Long Island time and again. It wasn't just this tropical storm. It's been Sandy, it's been Gloria, it was Hurricane Bill. Every time it's been a monumental failure, whether it was National Grid, PSE&G, Wilco, and I think we have to look at the basic building blocks of how our utility operates and make sure that we have a system that has more transparency and more accountability, because we don't have it now.
So we're running into the last few minutes. I really want to make sure that all of you get a chance to respond to the last question I have, because it's super important and comes from the audience. So please just try to keep your responses as short as possible, but it's a really good one. So, we've talked about, the ongoing surge of cases here in New York, all the budget problems, all these different pocketbook issues for seniors. I was hoping each of you could give me one specific example of what we can do of what can be done by state government in the next few weeks, next couple months, to really help seniors deal with the pandemic and all of its economic damage. Maybe we could start off with Assemblyman Englebright.
I again, for seniors, would underscore the importance of reinforcing and enhancing the programs that allow our senior citizens to stay in their homes. The costs of the alternatives are just so extreme. And so if there is a 20% across the board cut, I believe that we in the legislature should seek exemptions for specific programs that enable people to stay in their homes and to remain safe. And I think that would be consistent with the need during the pandemic to prevent the spread of infection and the cascade of costs associated with the spread of disease. So I anticipate we're going to see the executive budget proposing some percentage of across-the-board cuts, and I think we should be pushing for specific exemptions for the most vulnerable in our society, our senior citizens, and particularly the emphasis on keeping them from being exposed in congregate settings to the spread of disease.
Assemblyman DeStefano. Oh, you're muted. There we go.
Two things come to mind. One is my office has been working very diligently with the community. I have one designated person to call seniors to see how they're doing and if there's anything we can do. one of the things is, anything that can be like off of a state level, maybe on a county or a town level, we kind of give them the resources to go to other parts of government to see if there's any assistance available to them within the town or in the county. Sometimes there is, sometimes there isn't, but we always try to help them with other branches of government to see if we can do something for them. The second thing is, it's always been a pet peeve of mine, and I was hoping that someday that the governor's office would create this committee that was once there. I mean, total disgust with unfunded mandates. Totally, they are absolutely a thorn in everybody's side. And to Assemblyman Englebright's point, is that those are some of those things that we can, as far as moratoriums on certain things, that's something that every part of government, especially now with everything that we're facing, we could look to those unfunded mandates and see what we can relieve for the time being to get the monies necessary to keep some of these programs going. These unfunded mandates, especially in education and things like that, maybe we can curb some of them to give them a little bit of relief to be able to work within the budgets that they do have. So that was one of the things that I would like to get back on the table, to start looking into all those unfunded mandates.
Assemblyman Fitzpatrick.
Yeah, Steve raises a great point. I think exemptions are a good idea, but be ready for other groups that are going to ask for exemptions as well. Joe's thought on the suspending or terminating some of these unfunded mandates are critical. My big concern is we cannot endure another lockdown. I just think that is, we know a lot more today than we did back in March when we were first briefed on this. And a year from now, we're going to know a lot more after we experience, a possible, maybe probable second wave. But one thing I think is crystal clear. Our seniors don't benefit from a lockdown. I think we need to also allow one family member to act as a caregiver, as part of the caregiving team. I think that's critically important. Two, a serious look at reforming some things to reduce structural costs. But the lockdown is going to make our problems even worse. We know we have to isolate the elderly and those with comorbidities, but a lockdown creates so many more problems: psychological, physical, etc., alcohol abuse, physical abuse. It really isn't the answer, and it's not healthy.
And Senator Boyle, we're running out of time, but give us the fast and easy one thing we can do in the upcoming weeks.
Have the legislature take back the power from the governor so we can work as a co-equal branch. One issue very quickly, Zach, though, and I think it's going to be the biggest issue we're going to see in decades: the mandated vaccine for COVID-19. I believe the governor is going to mandate the use of this, and all the polls show that over 50% of New Yorkers do not want to take it. Maybe 60% don't want to give it to their kids. What does a mandate mean when half the state does not want to do something? An issue we need to look at and address very quickly.
Very important. And from the fighting first, Assemblyman Thiele.
Yeah, I think in the coming months, it's both related. Obviously, you mentioned COVID. One is access to testing. Make sure seniors can always get a test when they need one. We've made great strides. I've worked with my local hospitals to make sure that there were facilities for testing. And as Phil said, the vaccine, which could only be several months away. I'm going to take a slightly different issue, part of that issue, and that is we need to make sure that every senior citizen who wants the vaccine is able to get that vaccine, and they should be with the possible exception of healthcare workers and first responders. Senior citizens should be high up on the list of having access to the vaccine early. And so I think in the coming months, those are the testing and access to the vaccine are the two issues.
And just to close, before I close thing out with a few comments, Bill, maybe you can bring us back down to earth, really talk about just the general conditions you're seeing among the membership of, how dire the situation is for seniors out there.
I would say that one of the biggest impacts of COVID that AARP has heard from our members, from family organizations all across the state, and I think everybody here today and those watching, it's been reported in the media, is the nursing home issue. We've had over 6,700 people die in nursing homes. We've had families that have not seen their loved ones for 7 to 8 months. There is visitation going on right now. It's somewhat limited. And from AARP's perspective, what occurred in our nursing homes over the last 6-7 months can never happen again in our state. And I think that as we move into session and policy proposals are being discussed, we really need to take a look at nursing homes, what occurred, what didn't occur. We need to get the data from the Department of Health of who passed away in the hospital. I don't see how any legislator can do their job if they don't have a complete data set in which to make decisions on and to make policies to make things better. I think we need that. But overall, as far as keeping seniors at home and out of nursing homes, I think Assemblyman Englebright had it right. We need to really maintain those programs. We need to give people what they want. They want to stay in their homes. They want to stay in their communities. And when we do that, we save the state money in the long run because we defer or delay institutional care. So that's the little long, but that's what I have, Zach.
Well, obviously, so much up in the air. We'll see what happens with the budget, the pandemic, but unfortunately, we couldn't get to everything. We're running out of time, but I'm sure our legislators here would be happy to answer audience questions. Feel free to reach out to us at City and State if you have any trouble reaching them. And I just want to thank again our great sponsor for this event, the AARP. We got through some really great stuff. Got some good information out there, and let's try to keep the conversation going in the coming weeks and months because there's some real people being affected by this pandemic. We'll be doing our best to facilitate that discussion, including an upcoming event on November 17th, our virtual government procurement webinar, as well as another event on November 19th, where we come back virtually to the island with a similar discussion about how all these great issues affect things in Nassau County. So thank you so much, lawmakers, for coming in. Thank you to all of our great audience here, some really great questions. And thanks again to the AARP for sponsoring us. Hopefully I'll be seeing all of you sometime very soon.
Great.
Thank you.